Okay, so it's 1 o'clock, so we'll get started here. So first off, welcome everyone. My name is Claire Westmacott, and I'm the Manager of Knowledge Translation and Programs at Parachute. And we are very excited to welcome you today to today's webinar, which will be exploring illegal cannabis products, packages, and sellers. Please take a moment to introduce yourself in the chat and tell us where you're from. It's always really interesting to see where people are tuning in from. We'd also like to start today's webinar by acknowledging the land on which Parachute is located. For thousands of years, it has been the traditional territory of the Wendat, the Anishinaabe, Haudenosaunee, Métis, and the Mississaugas of the Credit First Nation. And today this land is still the home to many Indigenous peoples, and we are grateful to have the opportunity to work on this land. While we meet today virtually, we still encourage you to take a moment to acknowledge the importance of the lands which we each call home. From coast to coast, we acknowledge the ancestral and unceded territory of all Inuit, Métis, and First Nation people that call this land home. So today's agenda, we will be having two presentations. The first will be by Sergeant Shane Holmquist, followed by a presentation by Sandra Newton and Mary Ann Carew from IWK Poison Center and Child Safety Link. Lastly, we'll round off the presentation with a Q&A session, which will be facilitated by our Director of Knowledge Translation, Stephanie Cowell. So a couple quick housekeeping items. I know many of us are Zoom pros at this point, but the webinar will be recorded and all participants will be sent a link to view the recording of the webinar. We'll also be sharing out the slides from the presentations as well. Please use the Q&A button to submit any questions, and we'll be addressing those in the Q&A session at the end of the webinar. As you're leaving the webinar, we'll also be asking you to provide some feedback and short evaluation. And we'd really appreciate you taking the time to submit your feedback in the evaluation. This helps us guide our work, and it helps us support your work as well with these sessions. And before we get into the presentations, a couple quick events to point out. So we do have Poison Prevention Week coming up, March 20th to the 26th. And Parachute, as well as many of our injury prevention and poison prevention partners, are participating in Poison Prevention Week. And we have updated a number of our resources online. You can access them through this link here, and I'll post that in the chat as well. And we encourage you to take a look. There are a couple of handy pieces on there. We've got a social media guide, social media images, and then a couple of great resources you can share as well. And lastly, during Poison Prevention Week on March 24th at noon Eastern Time, we will be having another webinar. So this webinar today is the second in a series of 3 webinars that we are running. Our final webinar will be on March 24th, and that one will be exploring poison trends, and we'll be featuring presentations on some notable poisoning trends, 3 of them. So the first will be medication-related poisonings. We'll also have a presentation on self-harm poisoning hospitalizations in youth in BC, as well as a presentation on essential oils. Okay, so I'd like to now introduce our first presenter. So Sergeant Shane Holmquist has a Master of Arts degree in criminal justice and has been a member of the RCMP for the past 17 years. In his drug advisory role within the Federal Investigative Services and Organized Crime Section, he provides legislative and investigational advice to police officers in relation to cannabis. He is also a police representative on the BC Ministry of Mental Health and Addictions Core Planning Table Committee in relation to drug decriminalization. So thank you very much, Shane, for being here, and I'll turn it over to you.
Okay, great. Thanks for having me. Let's see if I can share the screen here. There we go. Can you see that? Okay. So I'm going to talk about some cannabis packaging today, and there's quite a few challenges to determining legal and illegal packages. And as we go through, you'll see what I mean. So what's interesting is the Canadian Cannabis Survey, and I'm not sure if you're aware of it, but they've got data going back to 2017, and it's available online. Essentially 5 years of cannabis surveys nationally, and survey findings have shown that in 2021. Those who purchased cannabis from an illegal or unlicensed source had purchased it from someone they knew, about 59%. And one thing that's really interesting with cannabis is social supply. There's quite a bit of academic research on social supply, and drug use is often quite social. People who consume know someone that consumes, and therefore they share, they find out deals and that sort of thing. 20% from a dealer, an unauthorized online seller about 20%, and an unauthorized storefront about 11%. But what's really interesting about this survey is that people were purchasing from a legal source in 2020, 37% were. By 2021, that had jumped to 43%. So what we're seeing is a general trend of people going towards the legal system instead of the illegal system. So just to start with some background on cannabis and the process on how it's obtained. Essentially, we have federal government regulated or Health Canada regulated grow factories, I call them, licensed producers. And they essentially grow cannabis. They're inspected by Health Canada inspectors. And in BC, these grow factories supply a provincial distribution warehouse. And then from that distribution warehouse, cannabis is sent to the BC government stores, BC government authorized private retail stores, and the BC government run online store. And then a person can also grow cannabis at home. We have approximately 832 of these licensed producer facilities across Canada, with a little over 140 of them located in British Columbia. And then for authorized retail cannabis stores in BC, as of last month, we had 405. So we've had some discussions with Public Safety Canada on trying to create a one-stop location nationally where someone could go to find out where they could purchase cannabis legally. And this site allows you to go to whichever province, click on, so for example, you click on British Columbia, it tells you that, okay, here are the stores. You can search by area. It gives you the online only option as well. So someone who's looking to purchase legal cannabis can reference this website. And at the end of the presentation, I've got links to all these sites. So one thing that was really interesting with this Canadian Cannabis Survey was that it's commonly stored in unlocked cabinets and drawers, childproof containers, and open shelves or tables. So when you look at these numbers, it actually adds up to, well, I guess a little bit more than 100%, because people were allowed to respond with multiple answers. But what we find is about 48% of people are storing it in childproof containers and locked containers. So that's a good thing. Obviously, we'd like to see this number increase, but approximately half of all the cannabis that's being stored in houses in Canada, according to the survey, are in childproof containers or locked, and the others are not. And this is a photo of a container for medical cannabis from a company called MedRelief, and they've since been bought out by Aurora Cannabis. But it's a great way to show how they had secure access to medical cannabis when the program first started. And the container just slides into the lockable container there with a little key access. And one of the challenges with cannabis legalization is trying to determine whether the cannabis is licit or illicit. So when you propose with a bag of cannabis that's in a bag like that, a lot of people would say, well, that cannabis is not legal. Well, in fact, if someone grew cannabis themselves at home with the 4 plants that they're allowed to grow, they don't have those packaging containers. So it could be in a Ziploc bag. And furthermore, there's no requirement to have cannabis stored in that sealed bag once you purchase it. So you go to the authorized retail store, you buy the cannabis, and then you transfer it to a Ziploc bag. There's no requirement that it has to remain in that Ziploc bag. The equivalent would be like having a cigarette or a beer and then pouring it into another container and then drinking out of that container. The package of these edibles, pictures of these edibles here are from the BC government store. So those are actually legal as well. So one thing that distinguishes legal cannabis from illegal cannabis is the way it's grown. And I'll talk about the Health Canada requirements for growing, but these are 4 different locations in BC where someone was growing cannabis and selling the excess. So the upper picture, you can see all the flies stuck to the glue strip there. The bottom right-hand picture is a spider mite infestation. And then the other pictures show mold growing on the walls. Some of it's so bad that the nails from the drywall screws are actually rusting right through the walls. Again, not all illicit grows are like this, but when you're purchasing from an illicit source, it's illicitly grown and you just don't know the quality standards in which it was grown. So on the legal side, when cannabis is grown, these licensed producers or grow factories have to meet good production practices. And this document is available online and provides a summary of the regulations. And Section 80 of the regulations basically say that it must be produced, packaged, labeled and distributed, stored, samples and tested in accordance with standard operating procedures. And Health Canada verifies all these standard operating procedures, and these grow factories have to follow them. And these include sanitation requirements, the cleaning agents that'll be used, the percentage of the mixture instructions, temperature controls, who's responsible, and the frequency of each activity. So when Health Canada inspectors go in and do audits, they will verify that they're meeting their standard operating procedures. So you can see the pictures here are quite a bit different on the way cannabis is grown inside these licensed producer facilities versus the illicit market. So the upper left-hand picture is going into a room at the Tweed facility in Smith Falls, Ontario. You're wearing a suit, a hairnet, and then we have air that blows at you to blow any dust or anything that's on you off. The upper right-hand picture is Aurora Cannabis in Edmonton, and the bottom right is Prairie Plant Systems in Saskatoon, which became Canamed. So again, you can see these environments are sanitary and they have to meet these standards. And all this is captured on video, so it's very easy for Health Canada to do audits to make sure that the cannabis is grown in a sanitary environment. So when cannabis is harvested, it goes through a drying process and it loses about 80% of its weight in moisture when it dries. So it's very important that cannabis is tested properly before it's sold. And again, the legal system has mechanisms for this testing, and they have to meet generally accepted tolerances under the Food and Drug Act. So for example, some cannabis concentrates are made with butane, which is an organic solvent. There are certain standards for parts per million of organic solvent testing. So again, on the legal system, you're guaranteed when you purchase this product that it meets those standards. And again, on the illicit side, you don't know what pesticides and so forth were used on the cannabis. So there are some fairly strict packaging requirements on the legal cannabis that is sold, and they're located within the cannabis regulations. And it sets out colors, logos, endorsements, no cutout windows, no embossing, engraving, etching, can't have any heat activated ink. So quite detailed. And you could actually, if you were to look at the packaging regulations, that could be a couple of days just looking at these details themselves. So a lot of these licensed producers, they will send samples to Health Canada to make sure that they meet all the requirements before they actually go into production and using them. Again, they have to be child resistant containers. They have a barcode. There can't be any association to liquor or tobacco products, not misleading information. And there's an equivalency to dried on the products. So for example, a cannabis concentrate, highly potent THC, will have an equivalency factor to dried cannabis. So for example, 1 gram of a concentrate, it'll say on the package equivalent to 4 grams of dried cannabis. Can't have any pictures of characters or animals no testimonials or endorsements, not appealing to youth. We'll have a packaging date and health warning, which is in bilingual English and French, has the generic cannabis symbol, the class of cannabis, and if it's been irradiated or not. And this is quite, a lot of people don't know about this irradiation, but most cannabis that is sold and packaged and sold through these retail stores have gone through an irradiation process. So it's very similar to the dose of radiation that's given to pepper kernels, for example, the pepper that you grind up and put on your food. Because cannabis is so heavily moisture before it goes through the drying process, like I said, about 80% of its weight is lost in moisture, that this irradiation process will kill any potential mold spores that could be in the product. And again, the warning has to be keep out of the reach of children, both in English and in French. So most of these packages have a selection of warning labels. So you can see here that there's a variety of different warning labels. There are some different warning labels for topicals, let's say, but generally for dried and edible cannabis, you'll see these warnings. So essentially, they will cycle through these. Not all of them will be on the same packaging, and English and French, and they'll have a yellow warning background on it. So when people see these packages, curious, too bad we couldn't do surveys, but a lot of people, when they see this packaging, they go, oh, I don't know, is this legal or not? Because, is it really plain packaging? Is it advertising to kids because of these bright colors? And these are all legal packages. So we've seen, some changes with these packages, and some of the conversations that I've had and trips that I've gone to Colorado and spoken to some of these grow factories and their marketing strategies is that traditionally cannabis is predominantly consumed by males, and the edible market is kind of an untapped market for females. So what's interesting is this grow factory owner had told me that their marketing strategy was to go to bright colors, logos, and advertising more towards that untapped segment of the market, and encouraging people, instead of having a glass of wine when you come home from work, taking the kids to and from soccer practice, is to have a cannabis edible. So I'm not sure that's the plan here on the Canadian side, but on the US side, that's been very successful. So we're seeing a lot of edible packaging now, legal Canadian packaging that has bright pink colors to it. So one way to verify if a package is legal or not is looking to find out who produced it. So Health Canada does have a website, and you're able to look licensed producers up. So for example, in this package, to find out if it's legal, we turn it over, and it says Daicar Pharmaceuticals Limited. And then ultimately you type that into the Health Canada website, and it lists that yes, they are an authorized licensed producer, and they're able to sell dried, fresh extracts, edibles, and topicals. So that's one way to determine if the package is legal, is if it has the authorized producer name on it. Another feature with the legalized packaging is the excise stamp. So these are all legal packaging, and you can see they all have excise stamps on them. So any cannabis that's purchased should have an excise stamp on it. And there is a short YouTube video that Revenue Canada put together, and it's about a minute long. And this is a little excerpt from that video, and it shows what these excise stamps look like. So if it has an excise stamp on it, that indicates that you're purchasing from an authorized cannabis retailer that has a Canada Revenue Agency license to sell that product. So any of these licensed producers that are selling cannabis in a particular province, they need to have an excise stamp for that province. So for example, a grow factory in BC that's also selling in Alberta, any cannabis that's sold to Alberta, it would be affixed with an Alberta excise stamp on it, and then transported to Alberta and sold in Alberta. So again, if you're in a particular province, the cannabis you're purchasing from that province should have an excise stamp on it. There are security features with these stamps. and actually have a scanning device to determine if they're a valid excise stamp or not. And there are provisions in the Excise Act 2001 if someone is trying to counterfeit and affix these illegally to products. So this is an example of how sophisticated some drug trafficking or drug selling organizations can be. In the past, when I was investigating street level drugs, it was a person driving around in a car with sandwich bags and little dime bags of drugs. But in this case, the person had got a consulting business license and was driving around with a variety of products. And you can see it says Nerd Ropes, 400 milligrams of THC. We've got Sour Patch Candies and Animal Mints. Just a really wide variety of product with labels and stuff that could be confusing to someone. And when he was stopped by the police officer, he showed this business license and said that he was allowed to do this when in fact, obviously not. So what do you think about this package? Legal or not legal? So this package would be illegal. It has cutout windows on it. And one of the interesting things with THC is it degrades with UV light. So when the packaging was put in place in Canada, they opted for opaque containers. And one of the reasons was it helps preserve the quality of that cannabis over a period of time. So again, here we don't have the THC label, we don't have warning label, we don't have barcodes, and we have cutout windows. So this would clearly be an illicit product. And this one gets quite tricky. So for example, it says Space Bar, lemon cheesecake, supernova, 150 milligrams. For edibles, we're limited to 10 milligram dose. And what's interesting is it says this product has been produced by an inspected cannabis production facility and tested for potency and food safety by a Health Canada approved facility. And then warning, keep out of reach of children, and the THC logo. So to the average person seeing this, they go, wow, it's got the THC logo. It's been inspected by a Health Canada facility. It's been tested. This must be a legal product. But the keep out of reach in children is not in English and French. There is no warning label with the yellow background, and it exceeds the milligram dosage for a package. So again, very misleading. And to the average person, it can be come across as a legitimate product. So someone could get cannabis tested from an authorized lab because cannabis is now legalized. So for example, if I wanted to sell some products, which would be illegal, I could take that cannabis product, send it to one of these authorized labs, which are available on the Health Canada website, and then get it tested and sent back. So when the product says it's been tested at an authorized lab, it's quite possible that it was tested from an authorized lab, but it is an illegal product. There are a number of offenses under the Cannabis Act, and for the purposes of this presentation, essentially possessing more than the equivalent to 30 grams of cannabis, equivalent to 30 grams of dried cannabis, is an offense. And in the Cannabis Act, it's basically punishable by up to 5 years in prison. Again, we're not going to see someone possessing 31 grams and going to jail for 5 years, but there are sentencing provisions in place for possessing more than authorized. And if someone's possessing more than in public, more than that equivalent amount, let's say of those chocolate bars, they had 10 of those chocolate bars in public, that would be an offense. Possessing cannabis they know is illicit, again, is also an offense. And then someone illicitly selling cannabis is punishable by up to 14 years under the Cannabis Act. And there's also provisions for promotion, appealing to young person, packaging and label, false misleading information, and that's also punishable by up to $5 million and an imprisonment up to 3 years and or both. So there are some sentencing provisions for offenses under the Cannabis Act related to possessing illicit cannabis or selling illicit cannabis. So these are some of the reference documents that I've used here, and I'm able to provide these to you if you'd like. And that's all I had for this presentation.
Wonderful. Thank you so much, Shane, for that really insightful presentation. It was really interesting to see how misleading those packaging examples can be. And I'm excited now to introduce two of our next presenters who will be speaking to illegal cannabis packaging and products from a poison center perspective, and talking about some of the collaborative work that they are doing as well. So Marianne Carew is a registered nurse and certified specialist in poison information, and has been a registered nurse for 38 years. Marianne graduated from the BG School of Nursing, Halifax in Nova Scotia in 1984. Her clinical experiences include both adult pediatric nursing, adult oncology, and she worked with Canadian Blood Services. Marianne has a total of 22 years of poison center experience and has written her certification for specialists in poison information exams twice. She is very passionate about poison prevention and has worked on planning Poison Prevention Week for their poison center for quite a few years. Sandra Newton will also be joining us today, and she's the manager of Child Safety Link at IWK Health in Halifax, Nova Scotia, and has been in this position since 2002. Child Safety Link is a maritime-wide child and youth injury prevention program. Within those years, she has also taught at Dalhousie University School of Health and Human Performance, teaching the health promotion policy course and co-teaching the injury prevention course as well. Prior to her focus on children's injury prevention, she coordinated an Impaired Driving Prevention Alliance in Kingston, Ontario, and also worked for the Ontario Ministry of Health Promotion Branch in Toronto. She holds a Master's of Science in Health Promotion from Purdue University, and in 2008, she completed her Social Marketing Graduate Certificate at the University of South Florida. She also holds a BSc in Biology and Nutrition and Health Promotion, and possesses a certification in Business Administration. She has worked in the field of health promotion, injury prevention for more than 25 years. So thank you very much for joining us today, and I'll hand it over to you. And let me just put up your slides here.
Thanks, Claire. I know you're going to manage our slides today, so thank you for that. So while she's doing that, I'll just thank Parachute very much for inviting us. And I want to wish everyone a good morning or good afternoon, depending on where you are in the country. So thanks for inviting us today. And we're going to be providing you with a Nova Scotia perspective on the issue of illegal cannabis. And it'll be the perspective of the IWK Regional Poison Center as well as Child Safety Link. Next slide. So we've done introductions, and then Marianne and I will provide you with an overview of our programs, and then Marianne will then provide you with some information on actually two recent poisoning cases from the IWK, and she'll also outline Poison Center and Child Safety Link concerns regarding illegal cannabis and its packaging. And then I'm going to provide you with some information about how Child Safety Link and the Regional Poison Center have collaborated and some next steps for us. So if you could, next slide. So as Claire's already mentioned, Child Safety Link, we are a maritime-wide child and youth injury prevention program of IWK Health in Halifax, Nova Scotia. The scope of our program is maritime-wide, so that means Nova Scotia, PEI, and New Brunswick. However, we do help support Newfoundland when we can, Newfoundland, Labrador when we can. And we focus on many priority areas, specifically falls prevention, poisoning prevention, child passenger safety, concussions, and ATVs. And I'm going to hand this over to Marianne to get into the first part of the Poison Centers piece.
Thank you, Sandra. Welcome, everyone. So I'm just going to give you a little overview of our Poison Center, but like all Poison Centers, we provide 24-hour coverage, phone consultation service to both the public and healthcare professionals and for individuals of all ages. Our mission is to reduce the incidence of illness or death due to exposure of toxins, for example, poisons. Our mandate is to provide timely and current information regarding the toxicological care of the poison patient and to follow these patients to determine their outcome. Our scope of practice at the IWK Regional Poison Center involves Nova Scotia and Prince Edward Island public and healthcare professionals from those provinces. In New Brunswick, we take calls from healthcare professionals only. And we're really excited and pleased to announce that as of the end of February, we have now taken Newfoundland and are answering calls from both public and healthcare professionals. Next slide, please. So just thought we'd mention 2 case studies. So the first one is a 10-year-old child who was brought into the emergency department after the parent found the child very sleepy, their eyes were red, and the child was acting, as the mother said, stoned. So we come to find out that this child had went into a cupboard and ate an entire package of what he thought was fuzzy peach candies, and they were Mary Jane's fuzzy peach candies. The mom was given these by a friend who had ordered them online because she was having difficulty sleeping. She put them in the cupboard, and the child just thought they were regular candy. Next slide, please. So as you can see here, very difficult to tell the difference what is cannabis and what isn't cannabis. I know Constable Shane had referred to this, but we're just going to talk a little bit more in depth about it on the patient end. So the package to the left was the actual package that the child had gotten into. So there were 5 gummies, and each gummy contained 70 milligrams of THC. The child required monitoring admission into hospital for 24 hours until symptoms resolved. So the parents said that they thought the package was hidden up in the cupboard. And again, it was purchased online. So next slide, please. So the second case study that we wanted to bring to light is the fact that more than one person can be involved with each case that we receive. So this particular case was an adult caregiver and 3 children had shared a package of cannabis gummies, not knowing that they were cannabis gummies. There were 5 gummies in the package, and one might think it's cute that each person was given one. But the package contained 500 milligrams, so 5 at 100 milligrams per gummy. These were called Stoner Patch gummies. All of them were symptomatic, including the caregiver, which there is a problem because the individual who was in charge of these children was in fact inebriated. So the children's ages ranged between 5 and 14 years old. The 5-year-old required hospitalization, was very drowsy, and did not return to their baseline behavior until about 22 hours after they've ingested the cannabis. Next slide, please. So when we look at illegal cannabis packaging, again, I know Constable had reviewed this, but quite clearly, you can see that there are several issues with this packaging. First of all, the THC logo is not the correct logo. The yellow, the area of concern is it's not yet indicated in or highlighted in yellow. It's not opaque. You can see the candy. And also there were each regulated is 10 milligrams of cannabis per piece. This one was 40 milligrams. Package contained 160. As I was trying to say, the warnings are not in yellow. The logo is different. And again, it was only in English language. Next slide, please. Another example of illegal edible packaging is these Starburst gummies. If one was to just look at it, you really difficult to tell if it's a real package of gummies or ones that were infused with THC. So this package is sorry, my slide just went. 1 second. So this package on the right contains 408 milligrams of THC, which is 68 milligrams per piece of candy. Again, exceeds the 10 milligrams per unit. Not plain packaging, it's copycat packaging, which is represents like comparable to a major candy brand. It's attractive to both children and adults. And as you can see, there is definite problem with this packaging. The THC logo is not the regulated logo. There is no warnings on this package. And also there's no type of child resistant packaging with this package. Next slide, please. So this one was really one of the ones that stood out to me. We had a call or a case involving this cinnamon toast crunched. Again, on this, there is quite a large amount of THC. And when we looked at the side of the packaging, you know, it told you a quarter of a bowl makes you this stoned, a half a bowl this stoned, and it was really quite something. It does, in fact, have the legal THC logo on it, but that's all that it had on it. Next slide, please. So just to reiterate, this package did contain 600 milligrams of THC in the box. Again, copycat packaging to popular cereal, attractive to both children and adults. Illegal packaging has no child safety packaging. Another issue to highlight is that the cannabis symbol copied from Health Canada is in fact an approved symbol. The package lacked legal warning symbols. And again, it's not a child resistant package. Next slide, please. So why is illegal cannabis an issue? So we are seeing an increased amount of children getting into cannabis edibles. And these, of course, are unintentional exposures. And because we see that the products are packaging is more attractive to children and adults, again, lack of production standards is concerning. So as was previously mentioned, exposure to certain pesticides or fungicides that are not Health Canada approved. Ingredients are not regulated. There could be allergens in the packages that aren't identified. Nutritional facts, etc., can be all an issue. The amount of THC and CBD dosing may not be accurate because, again, it's not regulated. The risk of contamination with mold or other products is of concern. Difficulty with product recalls, quality control, and they may have false health claims as well. Next slide, please. So to leave you with this is unintentional cannabis ingestions are 100% preventable. We want to create awareness that safe storage and labeling products can help to improve child safety and decrease the burden on our already taxed emergency departments. So we want trying to get the message across to people that label the products, lock the products, and store the products away is the only safe way to keep cannabis out of children's hands. And together we can help keep families safe when these things are implemented. And thank you very much for your time.
So if you go to the next slide. Thanks. So I'll just quickly go through the importance of collaboration. I think everyone on this webinar understands the importance of collaboration. And Child Safety Link and the Regional Poison Center, we've worked together since 2003 to promote poisoning prevention. And this includes lots of different work, but specific to cannabis and cannabis edibles, we've done quite a bit of work in the media responding to cannabis poisoning concerns. And I'll give you an example in a moment. We've advocated around cannabis edibles packaging. And we have done lots of awareness and education, specifically promoting Poison Prevention Week in March, as was mentioned earlier. And we've developed educational resources and social media. If you go to the next slide, please. So in terms of media, I just mentioned that we are in the media and we're in the media regularly. And we not only respond to calls from the media, but we also proactively send out media releases to discuss poisoning prevention topics, including cannabis. And so, for example, Child Safety Link has a monthly appearance on CTV Morning Live, and we often will reach out to the Poison Center to help us with those and participate in those together. And I've included a link here. I know these slides will be shared, so I've included links throughout, so you can just link here to see that particular appearance. And then we celebrate Poison Prevention Week, so that's in a couple weeks. And we do a lot of promotion through the media, and we've done mail outs of our educational materials to family resource centers across the region. And this year our focus is on storage, and our theme that we have decided to go with is label it, lock it, and store it. And we will be using a myth and reality kind of focus on our social media. And so for that might include something like a myth, my child can't get into a child-proof container, and the reality is that there's no such thing as child-proof. So we're going to be taking that approach. In terms of our website, both Child Safety Link and the Poison Center have websites with lots of information and educational materials. Child Safety Link is in the middle of developing a new website, and we hope that it'll be launched in the next month or so. And we will have information on poisoning, obviously, and we have our information by age and stage of the child as well as by topic. As mentioned, we do lots of social media, primarily Facebook and Twitter, and we also have something called blog posts, and that's more of just a different way of getting stories across around our messages. And we've worked with the Poison Center on several of these blogs. And so, for example, we had one on edible hazards, cannabis food, and your child's safety. And during Poison Prevention Week, we're going to have another one on the myth and reality theme that we're going to be going with. Next slide, please. This is just an example of some of our Facebook posts, and we find that the posts that are specific to poisonings, especially anything to do with lookalikes, are shared a lot, very broadly, and we sometimes get media pickup from these messages as well. So these are the basic social media posts, and then there's always messages along the side of them that will talk about how to contact the Poison Center for more information and how to reach them. Next slide, please. We have developed lots of educational material over the years, but specific to cannabis. As I mentioned, we do have a new website coming soon, but you can go through this link and you'll be able to get to our any of our educational resources, including this infographic called Edible Hazards, Cannabis Food, and Your Child Safety. And then in anticipation of legalization of cannabis back in 2018, I wrote a backgrounder document that outlines some basic concerns around cannabis edibles and childhood poisonings. And really it was just a way for me to get some good information and basic understanding of the issue. And so I did put a link there in case anyone is interested in that, even though it's a few years old, might be of use. And then a few years ago, we also created a document called Preventing Serious Injuries in Children and Youth in Atlantic Canada, a guide for decision makers. And the purpose of this guide is to highlight the importance of preventing unintentional injuries to children and youth in Atlantic Canada, but it also provides recommendations for comprehensive next steps and is outlined by many key areas, including poisoning. Now, I don't have the link here, but you can get to it through our library on our website. Next slide, please. In terms of advocacy, we do advocate when we can. So to prepare for legalization of cannabis edibles in the fall of 2019, the IWK as a whole responded to the call for comments regarding proposed federal legislation regarding cannabis topicals, edibles, and extracts. And there were several perspectives that were outlined, including safe storage, plain packaging, clear labeling, and restrictions on marketing. And in addition, the IWK developed a bit of a campaign to promote key messages, and several departments at the IWK, including Child Safety Link and the Poison Center, did an extensive amount of interviews. So if you go to the next slide, I mentioned about the importance of collaboration. And so as mentioned, there are several IWK departments that were involved in this. And I think I saw that Sarah Blades was actually on this webinar. So she is actually the leader of this, and I want to thank her for that. So Sarah is from the IWK Mental Health and Addictions Department, and then we had Regional Poison Center, Child Safety Link, and we had someone from Reproductive Care as well. And I think this is an excellent example of how all the different departments came together and shared their common concern as well as their differing perspectives on the issue. Next slide, please. So in terms of next steps, I mentioned we're launching a new website that will include poisoning prevention, continue to include poisoning prevention. And also Child Safety Link is launching a new strategic plan, which is literally on my desk and ready to be launched. And that will also include a renewed focus on poisoning prevention. In terms of the Poison Center, I know that they're going to continue with their cannabis surveillance with Health Canada and the Nova Scotia government. And if you have any questions about that, I know Marianne can help you. And as Marianne already mentioned, they're expanded to Newfoundland and Labrador, all of their services as of really just about 2-3 weeks ago. And collaboratively, we're going to continue to promote and provide awareness around poisoning prevention. And we are developing some more plans around poison awareness for the rest of the year. Next slide, please. So Lori, I think you're also on the call. I'm not sure if Chantel is here as well, but I want to emphasize the importance of collaboration again. And this is a photo of Chantel Walsh from Child Safety Link and Lori Mosier from the Regional Poison Center during our CTV Morning Live segment. And we just wanted to point out that we really bring two different lenses to the table. And the Poison Center, as Marianne has mentioned, is made up of poison specialists. They're on the phone, they hear the stories, they have the data and the background information. And then Child Safety Link, we're health promoters, and we turn this information, this data, into awareness, education, and other supports. I feel that health promoters have the expertise at communicating at a community level, and we can ensure appropriate reading level, appropriate messages, methods of disseminating information, and so on. As mentioned, we've worked together for more than 18 years, and we continue to evolve and grow, and we know there's a lot of work still to be done. And I would encourage you, no matter where you work, is to really reach out and find those partners to support each other in this important work. And I think that's it. The next slide is really our contact information. I've included the links for both Marianne and myself, as well as our Facebook and websites and so on. I think that's it from us.
Perfect. Thank you so much, Marianne and Sandra. That was a great presentation. I'll now hand it over to my colleague, Stephanie Cowell, who, as mentioned, is the Director of Knowledge Translation at Parachute, and she'll be facilitating the Q&A session. Take it away, Steph.
Thanks, Claire, and thanks, everyone. Such great information to share. You know, we have evidence in the research and literature and data from the Poison Center showing that you know, as anticipated, there are, you know, more cases coming to poison centers around pediatric cannabis poisoning exposures, as well as to emergency departments. And, you know, a recent study from Ontario also showed that there's increasing severity in these, more hospitalizations from those emergency department visits. So certainly something we need to continue to pay attention to and collaborate on, as Sandra so beautifully emphasized. So we've had a few questions come in, and also I want to encourage people to continue submitting through Q&A. If there's anything we can't get to now, we are happy to follow up with sending out information with the other follow-up communications that we disseminate. We also had a few questions sent in ahead of time from participants. So let's start with this one. The question is, can sellers use images of products that are in unregulated packages on their website or on other sites such as their Google business listing? So I guess, you know, do the regulations extend to what imagery they're including on their business sites? not sure if anyone has any comment on that.
Yeah, I guess that would be Health Canada regulated, and no, they shouldn't be having endorsements and things like that on their website. Again, it should all be meeting those requirements for packaging. I've known that some licensed producers have tried to partner with different people and get rights to like Bob Marley brand of cannabis, so they could use that as an endorsement. But again, there's certain cautions and rules in place for that.
Great, thank you, Shane. Okay, another question about THC analogs, and I'm not sure about for our speakers your awareness around these, but I'll ask the question, and if we're aware, we'll get an answer here. So, are you aware of any THC analogs such as Delta 8 THC or Exo THC? Hopefully, I'm pronouncing those right. In the Canadian market, what is the legal status of these compounds in Canada?
So I haven't heard of Delta 8, but there's a number of cannabinoids that are regulated under the Cannabis Act. So for example, CBD, non-psychoactive, is a phytocannabinoid, which means it comes from the cannabis plant, and that is regulated. So if you look at the definition of cannabis in the Cannabis Act, it essentially says any phytocannabinoid. So that includes CBN, CBD, THC, those sorts of things. Delta 8, I'm not familiar with. If it is a synthetic cannabinoid, then that would be regulated under the Controlled Drugs and Substances Act and not the Cannabis Act.
We have seen cases that involve Delta 8 cannabinoid, and we do see people getting more symptomatic from exposure to the Delta 8 aspect of this products.
Great, thank you. And I'm seeing a comment in the chat that Delta 8 it would be under that natural occurrence category. So thanks for that comment. Okay, I'm going to go to another question that's in the Q&A box. And says that, as we've seen with other products that are unregulated and potentially unsafe for Canadians, we have seen restrictions put in place. For example, baby walkers with wheels. Not only are they banned in Canada, but they are restricted from being imported to Canada. So the question that this is an in Canada commerce matter, can we pursue regulatory changes that would prohibit mailing of cannabis products? So I'm assuming that's referencing to mailing from outside of Canada into Canada that don't meet our regulations.
Sorry, you're talking about illegal packages of cannabis coming in from another country into Canada?
Right, yeah.
So obviously that would be, illegal. We've got fentanyl coming in from other countries as well. All that is done through the mail center. Canadian Border Services Agency is involved inspecting packages. So and Canada Post for that matter. So it's like finding a needle in a haystack. They're inspecting the best they can, but limiting it completely is challenging.
Thank you, Shane. Okay, I'm seeing a comment from the same question, that the question was actually about mailing within Canada. So partnerships to prohibit in-country mailing.
So
I guess for unregulated products.
Okay, so the in-country mailing is going to happen. It's been happening since really 2001 with the medical cannabis program, because when we first started as a result of the Parker case decision to allow medical cannabis, we have people who are growing cannabis for themselves, and then we have designated person production licenses, which allows someone to grow cannabis for another person. And the way to get cannabis to that person is through the mail. And medical cannabis right now, if you were to see your physician, get an endorsement, and then have the cannabis, receive that cannabis, it would be sent via the mail system to that person. So again, even now with legalization, if I'm giving up to 30 grams to somebody, that is legal. So I could send up to 30 grams of dried cannabis through the mail to someone else. Some of the reasons for intercept would be, you know, emitting a noxious odor that could affect the people in the mail center. But other than that, it is a legal commodity, and people are moving it through the mail system.
Interesting, thank you. Our next question, and maybe directed to you, Sandra, and maybe Marianne. You know, we've talked about the regulations, and that there are a number of regulations that target ensuring that these products are not attractive to children and youth. But there's a broader question of, is there more that can be done to protect children from attractive packaging when it comes to cannabis products?
Well, I'm sure there's lots that can be done. Yeah, I mean, I'm certainly not the expert in that, and that's something I think we need to look at a little more this year, Marianne, in terms of, is there any other advocacy that we can do around packaging? Right now, most of it is around awareness that we do, and providing information about how to store if you have it, because it is legal, not the illegal, obviously not the illegal stuff, but it is legal to use cannabis. And so it's about messaging appropriately. So there is work to be done there. I don't have a specific answer exactly on what can be done, but yeah, there is lots of work to be done. Obviously, we showed lots of examples of illegal cannabis packaging, and that's just the tip of the iceberg.
I think by bringing these products to light, you know, on via our social media posts, just to show what the concern is, and the fact that the only way to keep children safe is to lock it and store it, and not just have it out of reach. It really needs to be locked, which is one of our key messages that we're putting forth this year with Poison Prevention Week.
Well, and there's also an awareness that kids can't tell the difference. You know, some of those packages, I wouldn't know. I would just, you know, if someone gave me a pack, I'd probably eat the whole thing, not knowing it was cannabis. So a lot of people feel that their children have the ability to understand that packaging, what that packaging even means, but they don't understand. They don't have that capability. And so there is also an awareness factor with families around that their kids, no matter how smart they are, aren't going to understand that packaging. And so if you have a beautiful, bright label, they're going to think it looks yummy and they're going to eat it. So it is a challenge. Yeah, so there's a lot of work to be done in that area.
I want to quickly acknowledge there was a question from Shane's presentation about the cannabis survey data that was shown, and the question about Canadians reporting not locking up their cannabis, and whether the survey indicated whether the respondents had children in their home or not. I can add a comment there, and then Shane, I don't know if you want to say anything else to it, but Parachute did a national Ipsos survey specifically with Canadian parents. So they had to have at least one child aged 14 or younger in their home. And the results of that showed that 27% reported storing their cannabis edibles in a way that would be considered best practice. So up high, out of sight, and locked up. So we're seeing that the implementation of some of these best practice storage behaviors are a challenge, and something we can really continue to educate on and provide solutions for among parents specifically. Shane, I don't know if you wanted to say anything further to that. I believe the cannabis survey is just adults kind of at the population level.
Yeah, I've just pulled it up quickly here. It doesn't actually say, but I'm sure if you access the full report, they'd probably give you some details if there were kids in the house or not. It would just make sense that, you know, if you're surveying people about access to kids, that, you know, they would have kids in the house.
Yeah. And that some of the information from our survey of parents is available on our Poison Prevention Week page. There's an infographic highlighting some key results. We have a few more questions in the Q&A. However, I am conscious of time, that we are 1 minute away from our committed end time. So we are going to wrap up there for the Q&A. However, we will capture the questions that have been submitted. Thank you all so much for sharing your questions, and we will make sure that those are addressed in follow-up. So back to you, Claire.
Great, thanks so much, Steph. And I just want to extend a huge thank you to all of our presenters today. We really appreciate you lending your time and your expertise to this topic. We are still getting more questions, so we'll make sure to answer those. And thank you all to you for tuning in. And we'll be sharing out the information of this webinar shortly afterwards. You'll get the recording and the slides as well. So thank you again, and enjoy the rest of your Wednesday.